Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita.
And I'm Jean Marie. Today we're going to be discussing a very serious and often misunderstood disease, pancreatic cancer.
And Ron will not be joining us today. Pancreatic cancer is one of the most challenging cancers to diagnose and treat. But understanding how it starts and progresses is the first step toward earlier detection and better outcomes.
As always, this episode is for informational purposes only. Please consult your healthcare professional for guidance specific to your own health.
Okay, the pancreas is a small organ, kind of like a mouth organ, harmonica.
Okay, I was going to say, I don't know what you're talking about.
About 6 inches long, located deep in the abdomen, beneath or behind the stomach. It is shaped a little bit like a fish. It's wide at the head and tapers down to a narrow tail.
The pancreas serves two vital roles. The exocrine part produces digestive enzymes that break down fats, proteins, and carbohydrates. The endocrine part releases hormones such as insulin and glycagon, I can't say it, that regulate blood sugar.
And because it's tucked so deep in the abdomen, tumors can grow there for months without causing obvious symptoms. And that's a big reason why pancreatic cancer is often diagnosed late.
Most pancreatic cancers, approximately 90 to 95%, are exocrine tumors arising from the ductal cells that carry digestive enzymes. These are called pancreatic ductal adenocarcinomas.
The other, far less common group, are neuroendocrine tumors, also called islet cell tumors, and they develop from hormone-producing cells. These can be functioning, meaning that they create hormones like...
They secrete hormones?
What did I say, create?
Yep.
Oh, no, they secrete hormones like insulin or gastrin that cause distinct symptoms, or non-functioning, which don't produce excess hormones and tend to behave more like typical cancers.
Each type of pancreatic cancer behaves differently. Ductal adenocarcinomas tend to grow and spread more quickly, whereas neuroendocrine tumors often grow slower and may be treatable for years, depending on the grade and the stage.
Well, there are several factors that raise the risk for pancreatic cancer. Age is one. Most cases occur after the age of 60. Smoking roughly doubles the risk.
Other risks for developing pancreatic cancer include chronic pancreatitis, obesity, diabetes, certain inherited gene mutations like BRCA2 or PALB2, and possibly a family history of pancreatic cancer. People with Lynch syndrome or familiar melanoma syndrome are also at a higher risk of developing pancreatic cancer.
Also, long-term exposure to workplace chemicals, such as those used in metal refining or dry cleaning, can contribute to your risk of pancreatic cancer. But it's important to remember that anyone, even those with no known risk factors, can develop the disease.
Early symptoms, unfortunately, are typically vague. Abdominal discomfort, back pain, a loss of appetite, fatigue, and unexplained weight loss.
And one of the classic signs is jaundice, which surprises me.
Mm-hmm.
Jaundice is when you have yellowing of the skin and eyes, caused when a tumor blocks the bile duct. People may also notice a darker urine, pale stools or bowel movements, or itching.
New onset diabetes in an older adult without weight gain can also be an early indicator of pancreatic issues. Doctors are learning that pancreatic cancer can actually cause diabetes in some cases.
And because these symptoms overlap with many common digestive issues, people often delay in seeking a doctor until the cancer has advanced. That's why awareness and prompt evaluation of persistent symptoms are so critical.
Pancreatic cancer can spread rapidly through nearby lymph nodes, the liver, or the lining of the abdomen. Staging helps doctors plan treatment and estimate your prognosis.
The most widely used system classifies tumors as stage 1, which means it's confined to the pancreas, potentially operable. Stage 2, it's grown into nearby tissues or lymph nodes. Stage 3, it involves major blood vessels, often limiting surgery. And stage 4, it is spread to distant organs such as the liver or the lungs.
For neuroendocrine tumors, staging and grading also includes how quickly the cells divide, and that determines whether they behave indolently or aggressively.
Well, accurate staging requires imaging, things like a CT or an MRI, and sometimes surgical exploration. We'll cover that and the available treatments later on today.
Or in another episode?
No, later on today.
Okay. So let's review what the pancreas does. We talked about it a little bit, and the different types of pancreatic cancer, risk factors, symptoms, and how doctors stage the disease.
Well, we're going to move into diagnosis and treatment next.
Okay.
How imaging, biopsies, surgery, and new therapies are helping people live longer and better. We'll talk about how it's diagnosed and treated, from imaging tests and biopsies to surgery and newly targeted therapies.
As we said before, the pancreas, because it's located deep in the abdomen, early tumors are hard to feel during routine abdominal exams, and diagnosis usually starts with imaging.
The most common tests are CT scans, MRIs, and endoscopic ultrasound. A CT scan provides a detailed cross-section of the abdomen and helps define tumor size and spread.
An endoscopic ultrasound uses a flexible scope inserted through the stomach to get images right next to the pancreas and often allows a needle biopsy at the same time.
That sounds amazing
Mm-hmm.
that they could do that.
Mm-hmm.
A PET or a PET scan may also be used to see if the cancer has spread to other organs, and blood tests like the CA19-9 can help monitor disease activity, though they're not perfect for screening.
And imaging may suggest cancer, but a biopsy is typically needed to actually confirm it. Samples can be taken, as we said, through fine needle aspiration under CT or ultrasound guidance or through the endoscopic ultrasound, as we mentioned earlier.
Pathologists then analyze the cells under a microscope to determine if it's a ductal adenocarcinoma or a neuroendocrine tumor, and to look for specific mutations that might guide therapy.
Once the diagnosis is confirmed, the next step is staging to see whether the tumor can be surgically removed.
Pancreatic tumors are classified as resectable, which means that they can be completely removed by surgery. Borderline resectable, which means they're touching major vessels, but they might become operable after chemotherapy or radiation can shrink them. And locally advanced, unresectable, involving the vessels that are too extensively involved
Yeah.
for safe surgery. And then lastly is metastatic, which means it has spread to distant organs, like we said, the liver or the lungs.
For tumors limited to the pancreas, surgery offers the only potential for a cure. The most common procedure is the Whipple operation, popularized by
Grey's Anatomy.
Yes,
Yes.
I was going to say that episode of Grey's Anatomy.
Oh, there's been several.
Oh, okay.
Yeah.
I think I only saw the first one.
Well, that involves removing the head of the pancreas. Like we said, it looks like a fish.
Mm-hmm.
So that's the first thing you do when you're going to fillet a fish is remove the head. They should call it the fish operation. Anyway, part of the small intestine might be also removed. The gallbladder and the bile duct also might be removed. And then they reconnect the remaining organs. It's a very complex surgery done at specialized centers, but it has improved survival for patients whose tumors are caught early enough.
Tumors in the body or of the pancreas or the tail area, as Lita keeps referring to it, require distal pancreectomies, and occasionally the entire pancreas is actually removed.
Don't you need it?
Talk about it.
Okay. Even with successful surgery, most patients receive additional therapy to kill any microscopic cells that might remain.
Chemotherapy is used in several ways. Before surgery, it may be used, and then after surgery as well, or as a primary treatment if surgery isn't a viable option.
And common drug combinations are available, and these regimens help shrink tumors and slow the spread.
Radiation therapy uses high energy beams to target specific areas, and there are newer forms of radiation that are currently being utilized that allow precise delivery in fewer sessions with less damage to the surrounding tissue.
Genetic testing has revealed that there are specific mutations that open the door to targeted therapy. For example, patients with BRCA1 or BRCA2 mutations, they may benefit from PARP inhibitors like olaparib.
Some neuroendocrine tumors respond to medications and actually slowing the growth and controlling the hormone-related symptoms.
And immunotherapy has shown limited success so far in pancreatic cancer, but researchers are testing combinations of checkpoint inhibitors and they do that with chemotherapy and vaccines to stimulate a stronger immune system response.
And even if a cure isn't possible, treatment can extend the life and improve the comfort for patients. Palliative care, as we've spoken of before, as an adjunct to treatment, focuses on pain control, digestive issues, and nutrition, and that can be applied to most patients.
Well, when you talk about bile duct stents, those can relieve jaundice. So it's kind of like a heart catheter stent, but these are bile duct stents. They put them in the bile duct and it opens them up. Enzyme supplements replace the digestive juices that the pancreas no longer produces. And dietitians can help maintain weight and energy during therapies.
Emotional and psychological support are just as important as surgical or any other sort of physical support. Specialized pancreatic cancer centers often offer integrated care for patients and their families. Next, we'll look at the preventative and risk reduction aspects of pancreatic cancer. What can you do to lower your chances of developing the disease, especially if you're at a higher risk, with a focus on prevention and risk reduction? And what is within your control and what can be done if you are considered high risk?
Right. Well, there's no guaranteed way to prevent pancreatic cancer, but research has identified several factors that could make a real difference. One of the biggest challenges with pancreatic cancer is that it often doesn't cause symptoms until it's advanced. That makes prevention and risk awareness especially important.
And the majority of cases are sporadic, meaning that they occur without a clear inherited cause. But lifestyle factors, inflammation, and certain genetic syndromes can raise your or increase your risk of developing pancreatic cancer.
The most significant modifiable risk factor is smoking. Cigarette smokers are 2 to 3 times more likely to develop pancreatic cancer than non-smokers.
And good news here, the risk of developing pancreatic cancer drops immediately after quitting and continues to decline as you, the more,
Time you got under
the
your
more
belt.
time, yes.
Yeah.
So within a decade, it can approach that of someone who has never smoked. So
that's
the
excellent
sooner
news.
you stop smoking, the better.
Good. And vaping and smokeless tobacco are not safe substitutes either. Both of them introduce carcinogens into the digestive system and pancreas. Quitting entirely is the best protection.
Obesity is another risk factor when it comes to pancreatic cancer. People with a BMI over 30 have a higher risk, especially if extra weight is carried around the abdominal region.
Okay. And staying active and maintaining a healthy weight lowers your risk. Aim for at least 150 minutes of moderate exercise per week. Even brisk walking makes a difference.
A balanced diet can also help. An emphasis on fruits, vegetables, and whole grains, limiting your processed meat and saturated fat intake, and then choose lean proteins and healthy oils whenever possible.
Diets that are high in red and processed meats and low in fiber appear to be linked to higher pancreatic cancer rates, and sugary drinks that spike your insulin might contribute as well, since long-term insulin resistance can stress the pancreas.
Chronic pancreatitis, or long-term inflammation of the pancreas, significantly increases risk. Managing underlying causes like gallstones or alcohol use helps protect the organ.
And people with diabetes, which we've been talking about recently,
Mhm.
especially for new onset diabetes after age 50, should be on alert to unexplained weight loss or abdominal pain. That doesn't mean that cancer is likely, but it does warrant a closer follow-up.
And keeping, as we said, blood sugar under control through medication, diet, and exercise can support overall pancreatic health.
Just that little organ, 6 inches long, and look at all the importance it does, huh? Heavy alcohol use can damage the pancreas over time and lead to pancreatitis, setting the stage for cancer.
The American Cancer Society recommends limiting alcohol to no more than 1 drink per day for women or 2 for men, or avoiding it altogether.
Good advice. There's also growing evidence that certain occupational exposures, like pesticides or metalworking fluids, can raise the risk. Use proper protective equipment is very important.
Approximately 10% of pancreatic cancer cases are hereditary. People with multiple family members who've had pancreatic cancer or who carry mutations in the genes, as we mentioned before, BRCA2, PALB2, or even STK11, should consider genetic counseling and monitoring.
Well, testing can identify those at high risk. If a mutation is found, doctors may recommend regularly imaging, such as an MRI or endoscopic ultrasound, beginning at around age 50 or 10 years earlier than the youngest affected relative.
There's even a term for this, familial pancreatic cancer kindreds, meaning families with 2 or more first-degree relatives who are affected. And specialized high-risk screening programs exist for families with these that are predisposed to developing pancreatic cancer.
Right. And that makes it really difficult for adoptees not knowing what their family genetics are.
Right. But I think if you consult your healthcare provider on a regular basis, one question that my healthcare provider always asks is, have you lost, a significant amount of weight without trying or without any modifications? And that, I guess, to them is a red flag. And then they would look further to see what's going on.
Okay.
So,
it's like a warning sign.
It is a warning sign. So seeing your healthcare provider and keeping, a chart of what's going on with you can help healthcare providers identify issues, hopefully early on.
Okay. Well, chronic inflammation plays a role in many cancers, and the pancreas is no exception. Conditions like long-standing pancreatitis or Helicobacter pylori infection, can both increase the risk.
Environmental exposures like radon, which we've spoken about in the past, secondhand smoke or air pollution can also or may also contribute to one's developing pancreatic or increased risk of developing pancreatic cancer. While some of these are hard to avoid completely, awareness helps in making safer choices about the home and the work environments.
Very good advice. Well, for now, there's no population-wide screening test for pancreatic cancer like we have for colon or breast cancer. That's partly because it's rare and testing carries its own risks.
But as we mentioned, those individuals in high-risk categories can and should undergo periodic imaging and consult their healthcare provider to find out what they need to do. And for everyone else, prompt attention to persistent digestive systems, unexplained weight loss, fatigue, or jaundice remains the best form of early detection.
Awareness is a form of prevention, too. Understanding your family history, quitting tobacco, and maintaining a family health maintaining a healthy lifestyle all lower the risk, and they improve overall health at the same time.
Research shows that when people understand their personal or individual risks, they're more likely to make changes that truly matter to them, such as quitting smoking, losing weight, or maintaining a healthy weight, and seeking medical care when needed. And the earlier, the better. If we can have time, then we can, if we have time, we'll explore the latest research and clinical trials, including new diagnostic tools, targeted therapies, and experimental treatments that are offering hope for the future.
Okay, well, let's continue then. Rather than putting this off, let's just hit all the levels of it.
Okay, so we'll talk about
now we're going to talk about we already talked
new
about
research, clinical trials, and innovations.
Sure.
Okay. They're offering hope for future patients?
I guess so.
All right. Well, pancreatic cancer remains one of the toughest cancers to treat, but progress is being made in detection, treatment, and understanding how the disease behaves at a molecular level. Because early diagnosis is the biggest challenge, much of the research done today is focused on finding or locating pancreatic cancer sooner.
Scientists are developing a liquid biopsy test that look for tumor DNA, RNA, or proteins in blood, saliva, or even stool samples. Some of these experimental tests can detect molecular changes before tumors appear on imaging.
And there's also work underway looking at biomarker panels that combine several indicators, such as tumor DNA circulating, to improve accuracy in diagnosis.
Researchers are even exploring breath-based sensors, like when you have a breath test, right? They can detect volatile organic compounds that are released by cancer cells. It sounds a little futuristic, but pilot studies are showing promise in that area.
Well, and I know that there have been canines that have been able to identify cancer based on breath samples. Yeah.
Okay.
So I guess there is something at that molecular level that is carried on the breath that they can detect. Advances in imaging are another exciting area. Enhanced MRIs and PET scans now use special tracers that bind to pancreatic cancer cells, making them basically light up and are therefore easier to and more clear on imaging and easier to identify.
Artificial intelligence is also being used to analyze CT and MRI images because AI can spot subtle patterns that are invisible to the human eye. Potentially, they can catch tumors at stage 1 when they're still operable.
Right. So integrating AI along with, the radiologists, where those two forces working together may really affect
early detection.
Yeah. And on the genetic front, we've learned that pancreatic cancer isn't just like one disease, but there are several molecular subtypes. Understanding these differences helps to tailor the treatment to each patient and their specific situation.
Right. For example, tumors that have DNA repair mutations like BRCA1, BRCA2, or PALB2, they may respond to PARP inhibitors such as olaparib. These drugs exploit weaknesses in the cancer cell's ability to repair DNA, leading to their death while sparing normal cells.
Other researchers are studying how the tumor microenvironment, the dense tissue and immune cells around the cancer, makes it resistant to therapy. And by targeting that microenvironment, future drugs may improve the effectiveness of chemotherapy and immunotherapy.
Well, speaking of immunotherapy, that has changed the game for some cancers, but pancreatic cancer has been a little more resistant, largely because the tumors are surrounded by a tough, fibrous barrier that keeps immune cells out.
And I guess, it bears repeating, cancer is just when your cells start dividing uncontrollably and don't die off like they should.
Right.
It's not like it's a outside
foreign
force.
Cell.
Right. So it is a challenge in all these, regions because you have to kill off these
your
cells.
cells.
Yeah, your
right.
own cells. Yeah.
Right.
Scientists are developing new strategies to overcome that barrier, and some use enzymes, for example, to break down the fibrous tissue, allowing your own immune cells and medications targeted to treat the pancreatic cancer to penetrate into the tumor.
And others are testing cancer vaccines that are designed to teach the immune system to recognize pancreatic tumor antigens. Early trials, including mRNA-based vaccines, similar to the COVID-19 vaccine platforms, have shown encouraging results.
Increasingly, treatments are being personalized. Doctors are combining chemotherapy, targeted agents, and immunotherapy in custom regimes based on the genetic and molecular profile of a specific cancer.
There's also exciting work going on with this, I think they call it CAR-T cell therapy, which involves reprogramming a patient's immune cells to attack the cancer. Though it's still early, trials for pancreatic cancer are underway at several major research centers.
And clinical trials remain the key pathway for progress, and many of today's standard treatments began as a clinical trial. Patients who join trials often gain access to cutting-edge therapies years before they are widely available to the public.
Which is a good time to mention that we support patients
Research.
or people that want to join the research in order to blaze that trail for others and themselves.
Yeah.
It's important to understand that trials are carefully regulated for safety, and they may involve different phases, from small early studies testing the safety to large-scale comparisons of new drugs versus a standard of care.
And one avenue to find out about clinical trials is the National Cancer Institute database, or clinicaltrials.gov here in the U.S. And there are also, you could also consult at major cancer centers in your area. Participation is always voluntary, and patients can leave a study at any time.
Research isn't only about curing cancer, it's also about improving life during and after treatment. Studies now focus on pain management, nutrition, fatigue, and emotional well-being.
Supportive care teams, including palliative specialists, dietitians, physical therapists, and counselors, have become integral parts of cancer treatment. The goal is to treat the whole person and not just the tumor.
Right. For years, pancreatic cancer had a reputation as being hopeless, but survival rates are slowly improving thanks to early detection, better surgery, and new systemic therapies.
The 5-year survival rate was once at 5%, but has now climbed to approximately 13% here in the U.S. Although that that is a low number still, but that number represents thousands of people who are living longer, more meaningful lives.
Researchers and advocacy groups like the Pancreatic Cancer Action Network and the Lustgarten Foundation continue to push for earlier diagnoses, patient education, and research funding.
Every new clinical trial, every small improvement adds up. The story of pancreatic cancer is no longer just about grim statistics. It's about momentum, collaboration, and hope.
So to summarize, we learned about pancreatic cancer, what it is, who it affects. We covered the diagnosis, treatment, and symptom management. We discussed prevention and lifestyle factors that lower the risk. And we explored the breakthroughs paving the way toward better outcomes and someday a cure.
And science is catching up, awareness is growing, and people diagnosed today have far more options than even a decade ago.
And that's the message we want to leave with you. There is progress and there is hope. That wraps up today's episode of PodcastDX.
Thank you for taking the time and joining us today.
Please visit us at podcastdx.com to learn more and find links for our references.
And as always, please keep in mind, this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you've heard on this podcast.
Till next week.
Stay healthy and stay safe and stay informed.